Okay, hello to whoever is grading this. They told us advisors, so if that's the case, hello, Professor Hicks. This is my wife, Madeline. She'll be our patient today. We have a grunting baby on the floor, so if you hear any sounds, that is where it's coming from. But today we're going to start with our eye exam. We're going to start with the vital signs of the eye, and we're going to do visual testing, reading from the chart, and then we're going to do visual fields. So, Madeline, we're going to test your eyes today, okay? I'm going to have you read from this card. This card says 6 feet from you, so I'm going to go ahead and stand 6 feet from you. And Madeline, I'm going to have you cover one of your eyes, and I'm going to have you read this line for me.
DNJBS.
Okay, so she went ahead and read this one. She said DNJBS. It's an H. So I'm going to move her down to this, or actually move her up one. So Madeline, cover the other eye and read that line for me.
OLCF.
Perfect. And then take your eyes off, your hand off both eyes. And then with both eyes, read this line.
DHJBS.
Okay. So I had her move down for this one because I figured that she would read it with both eyes open. I know my wife pretty well. I know that one eye is worse than the other. So she's in between these two, which is 20/50 and 20/40. Now that we got that out of the way, we're going to go ahead and do our visual field test. I'm going to have Madeline start off by covering her right eye. And I'm going to cover my right eye. I'm going to be the standard. I'm going to test both superior and inferior on both sides. And this will test her peripheral vision. So Madeline, can you see my fingers?
Yes.
Okay, so tell me when they start wiggling and tell me when they stop wiggling, okay?
Okay. Start. Stop.
Perfect?
Start. Stop.
Perfect. And then I'm going to have you keep that. I'm going to switch my hand. I'm going to do the other side. Can you see my fingers?
Yes. Start. Stop. Start. Stop.
Perfect. And then go ahead and cover your other eye. I'll cover that same eye and we'll test this side.
Start. Stop.
You see my fingers?
Mm-hmm. Start. Stop.
Okay. And then I'll switch.
Start. Stop. Start. Stop.
Perfect. Okay. So we test vision capabilities with the card chart, and then we also went ahead and tested our peripheral vision, and Madeline's peripherals are okay. So now we're going to go ahead onto our inspection and palpation portion of the eye exam. So we're going to start just by an inspection. I'm going to start with the eyebrows. Madeline's eyebrows, I'm making sure that they extend from the medial canthus all the way to the lateral canthus. Her eyebrows are a normal texture and normal size, so there's no issues there. Moving on, I'm going to go from the eyebrows to the orbital area. When I look at the orbital area, I'm looking for any edema, bruising, or swelling. I can't see anything, so there's no concern there. And also while I'm in the orbital area, I can also look at the eyelashes. So as I kind of come in here, I'm going to have Madeline blink and open for me. So I'm looking for any type of lag in the eyelid or any type of ptosis in the eyelid. As I get closer for inspection, I'm looking at the eyelashes. I'm looking for any flaking. I'm looking for any ectropia or entropia, which is the folding of the eyelids. I'm also looking for any other disorders of the eyelid. So I'm not seeing anything there. And as I'm going from so I did eyebrow, I did orbital area, I did eyebrow, orbital, eyelid. And then we're going to go ahead and do a little bit of palpation and looking at the orbital. So I'm going to have Madeline close her eyes. And I'm just softly palpating the orbit. The orbit should be kind of soft and spongy. If it's hard, we're thinking glaucoma. And also while I'm doing that, I can feel any lesions or any lumps or bumps, either on the eyelid, a meibomian cyst, or I'm also feeling anything on the eyelid, or on the eyeball itself, pterygon or pinguecula. So I'm looking at the sclera, the eye too. I'm looking for any yellowing indicating of jaundice, or any lesions like I just mentioned. Sclera is white and non-injected, and there's no concerns of the sclera. I'm also looking at the iris and the cornea as I move to the anterior part of the eye. I'm looking for any type of cataract or any type of blocking of the cornea. Her corneas are clear with no signs. I mean, I'd have to do other tests, but no signs of lesions or scrapes. And her irises are brown. So other than that, there's no concerns on the eye exam there. After that, we're going to go ahead and do two tests. We're going to do a Perla test and a muscle test. So a Perla test means pupils are equal, round, and reactive to light, and then we also test accommodation. I'm going to take my little nifty chart here. I'm going to measure Madeline's pupils, and I'm measuring them around a 4 or a 5, which is normal. I'm going to go ahead and take my nifty fundoscope here, and I'm going to just do a quick light reflex of the eye. So I'm going to first do a direct light reflex. So I'm going to go ahead and shine it in her right eye, and I'm looking at the right eye just to make sure that there's a constriction of the pupil, and there was, or her left eye. I'm going to go to her right eye now and shine it in, and there was constriction. So I've done a direct light. Now I'm going to do a consensual light test. So I'm going to shine the light in her right eye, but I'm looking at the left eye. And the left eye constricts upon light in the right, and the right constricts based upon the light into the right eye. Go ahead and pick her up. So we've tested pupils, direct and consensual light reflex, and then we're going to go ahead and test for accommodation. And accommodation is real simple. Hi, Anthony. Accommodation is I'm going to have Madeline look over my shoulder at the wall, something far away, and have her focus on it. I'm going to have my finger close on one of the sides of her eyes, or on one eye. I'm going to pick her left one first. So Madeline, once I say focus on my finger, go ahead and focus on my finger. Okay? So keep your eye on the wall. Go ahead and focus on my finger. And I'm looking at that eye, and I should be seeing a quick constriction and then a refocus. And I did see it. So I'll go ahead and test the other eye. Look at the wall, and go ahead and look at my finger. And there was just a quick one. You have to be kind of quick, and I did see it though. So then accommodation is checked. After that, we're going to move on to kind of the H test. This is going to be testing muscles. We are going to do, the one thing I'm not quite sure on, and I would like just a little feedback on, is the corneal light reflex. In the video, she showed that we just kind of shine directly in the center of the patient, and we should be looking at just kind of like a generic corneal light reflex. I tested her light reflex, both direct and consensual, and there were no problems to me. So if you could provide any feedback on what that test that's separate from the direct and consensual light, that'd be great. But I'm going to go ahead and do the H test. The H test is testing all the muscles of the eye. The lateral rectus and the medial rectus are controlled by cranial nerve 6 and cranial nerve 4 respectively, and the rest are cranial nerve 3. So watching both eyes are going to tell us how the muscles are working. So go ahead and watch my finger. I'm going to be moving the H pattern down and up, and back to the center, and then the other side. So I'm watching and making sure that the eyes, you go ahead and stand up. I'm going to go ahead and make sure that the eyes are moving at the same timing, and that there's no lapsing between the two eyes respectively. So that was the H test. That's testing cranial nerves 3, 4, and 6, and then also testing the muscles. After that, we're going to go ahead and move into the fundoscopic portion of the eye exam. So I'm going to go ahead and kind of bounce around with my wife standing. Of course, I'd have my patients sitting and being eye level with them, but for this, I'm just going to be talking through it. So we're going to start with a light reflex. This is just a simple looking for the red light, just the refraction of the light back from the back of the retina. So I'm going to stand a little bit away from my patient and just look through the lens and make sure I get a light reflex on both sides. And there's a light reflex bilaterally. I'm going to go ahead and move the light back to the small portion and kind of turn it down a little bit. Sorry, you're sad, actually. At that point, move on to the actual looking into the eye. And I would be on the same level as my patient, and I would start in looking into their right eye, closing my right eye with closing my left eye, looking into my right so that I'm not over top of their midline. And I'd look in, and as I move to the 15-degree angle, I should be able to see the optic cup and disc. While I'm back there, making sure that they're in the right portions. And then I'm also looking for any AV nicking. I'm looking for any, I can also maybe see a retinal detachment while I'm back there, but I'm looking at the back of the retina and describing what I'm seeing back there. So that would do that bilaterally and making sure that I'm staying out side to side so that I'm not over top of their midline. Other than that, the only other thing I can test with the fundoscope is, I don't know what they call it, but depth of the anterior chamber. So what I would do is I would shine the light from the side, and at this I'm just shining it kind of over the top of the cornea, and I'm looking for any shadowing on the cornea. If I see any shadowing in the cornea, a moon type shadow, I know there's a specific measurement, but any type of shadowing that kind of covers inside the pupil, I'm thinking that they have a really small anterior chamber. That puts them, that puts them at a higher risk for glaucoma, and it also is an indicator for not giving a patient any dilating drops that could put them into some eye pain and pretty much into acute glaucoma. So that kind of does the fundoscopic exam. I would document or report any findings or abnormal findings that I would come upon on the exam. And that is pretty much the eye exam. Looking forward to your feedback. Thanks.